Hello everyone, this is Dr. Manika Sharma, Haryana State Women Wing Secretary of Democratic Medical Association. I'm here to talk about a cancer which can actually be eradicated, a silent enemy of every woman. This is a very common virus which affects every woman at some part of their life. Some bodies just fight it off, and in some bodies it sits for 10 to 15 years before it causes cancer. We exactly know what causes it, we have a vaccine for it, and we even have a test for it which detects the problem before it turns into the cancer. So how do we stop this? You might have heard of the vaccine Gardasil and our India's very own Sarvavec. I'll tell you a little about the vaccination schedule for the girls. If the girl is aged 9 to 14 years, there are 2 doses. If she is aged 15 to 24 year or immunocompromised, then there are 3 doses. Dose 1 and 2 should have the gap of 4 weeks, and dose 2 and 3 should have the gap of 12 weeks. Please do not hesitate to get your daughter vaccinated. It is really protective and it is must for her. For every woman who are over 30 years, we have a safety net. The screening process, which includes HPV DNA testing and the pap smear. I know many of you are hesitant, you feel shy and you worry that it might hurt, but as a doctor, trust me, it takes less than 5 minutes. It is not painful, you do not need anesthesia for it, and it is an OPD based procedure. If you are 30 or more than that, promise yourself that you will get yourself screened, and if the reports are normal, then you do not have to worry for next 3 to 5 years. So I like to talk about the risk factors such as smoking, OCP use, which is very common these days due to PCOD, any underlying infection like HIV, or the chronic use of steroids, or post-transplant, or multiparity if you have more than 3 kids. This gives a repeated trauma to the cervix. What if there are symptoms? You do not need to worry. If there are symptoms like post-coital bleeding, or post-menopausal bleeding, or bleeding between your periods, or you have a foul smelling discharge, there's nothing to be ashamed of. Go to your gynecologist, get the treatment done. Early detection can really help you cure the disease. So at last, I hope I was able to convey my message. This is just to make you aware. Do not ignore the symptoms and get yourself checked, treated, and take care of yourself. Thank you.